Let's be real for a second. Have you ever been stuck in a waiting room filling out the same paper form for the 10th time and just thinking, there has to be a better way? Well, you're right, there is. And it's not science fiction, it's already here. Today, we're diving deep into the Smart Clinic, which is a total reimagining of how healthcare gets delivered.
We all know the old way, right? Manual everything, mountains of paper files, and a system that pretty much only kicks in when something's already wrong. The new way, the smart way, is all about digital tools, data that actually talks to itself, and care that can predict problems before they even happen. It's a huge shift from just reacting to problems to actually getting ahead of them.
So what exactly is a smart clinic? Look, it's not just about having a few fancy new gadgets. It's a healthcare facility that actually weaves advanced tech, we're talking artificial intelligence, the Internet of Things, cloud computing, into its very DNA. The whole point isn't just to be digital for the sake of it, it's to build a complete healthcare ecosystem where every single part works together to make things way better for everyone involved.
Okay, so how does this whole ecosystem actually tick? Let's pop the hood and take a look at the core technologies that are really powering the Smart Clinic.
It all starts with the digital backbone, a cloud-based management system. Think of this as replacing all those clunky, dusty on-site servers and massive filing cabinets. Suddenly, everything, your patient records, the billing, all the appointments, it all lives in one central, secure spot. This gets rid of scattered, siloed information and frees up staff from drowning in administrative paperwork.
But here's the thing. Just having all your data in the cloud is only half the battle. That data needs to be able to move and communicate. This is called interoperability, and it's absolutely crucial. It's about making sure different systems can actually talk to each other. A great example is Wellstar Health System. They use a standard called FHIR, which is kind of like a universal translator for health data to sync up their patient records with their customer management systems. The result? A single, unified view of the patient. No more data getting lost in translation.
Now, if the cloud is the backbone, then artificial intelligence, well, AI is the brain. It's the cognitive engine that brings actual intelligence and automation to the whole operation.
And AI is a serious multitasker. It can analyze medical images, like X-rays, with incredible speed and accuracy. It can act as a co-pilot for doctors, offering suggestions to help support their clinical decisions. It can even automate the boring stuff, like documentation. In fact, the SmartCare platform at HKUST can auto-generate over 30 different types of medical documents. Think about that. It frees up doctors to actually spend more time talking to their patients.
And this isn't just some theoretical idea, this is real-world impact. In a project with Penda Health in Kenya, a simple AI co-pilot reduced diagnostic errors by 16% and treatment errors by 13%. I mean, wow, this technology is directly saving lives and improving care right now.
You see, a smart clinic isn't really confined to a physical building anymore. Through things like telemedicine and remote patient monitoring, care extends right into your home. This is an absolute game changer for managing chronic conditions like diabetes or heart disease, because doctors can track your vital signs in real time and step in before a small issue spirals into a real emergency.
And all of this is powered by something called the Internet of Medical Things, or IoMT for short. It's this whole network of connected devices, everything from the smartwatch on your wrist to smart beds in a hospital room that can help prevent bed sores. All of these devices are constantly gathering data, creating this rich, continuous picture of a patient's health.
Okay, so we've seen the tech, and it's pretty cool. But why does it all matter? Let's shift gears and talk about the real, tangible benefits for patients, for doctors, and for the entire healthcare system.
For us, the patients, the benefit is super clear. It's just a better, way less stressful experience. AI can help schedule appointments to slash those wait times. Telemedicine makes care accessible from pretty much anywhere, and having a complete picture of your health data means you can get a truly personalized treatment plan.
But here's maybe the most important benefit of all: safety. That 13% reduction in treatment errors we saw in that Nairobi trial, that means one thing. Smart clinics aren't just more convenient, they are fundamentally safer.
And for the healthcare system, the efficiency gains are just massive. Automation completely crushes the administrative burden, smart monitoring helps lower hospitalization rates, and smart building management can even cut energy consumption by up to 30%. That's a huge operational saving.
Now, of course, a transformation this big isn't a walk in the park. So let's take a balanced look at the road ahead, acknowledging the hurdles but also pointing out the incredible progress that's already being made.
Yeah, there are some real challenges to solve here. Data security and privacy, that's non-negotiable.
Making shiny new tech with clunky old systems can be a real headache. The initial cost can be high, and maybe the biggest piece of the puzzle is getting staff trained up and actually on board with totally new ways of working. These are all significant hurdles for sure, but they're not insurmountable.
And we know these hurdles can be cleared because people are already doing it all over the world. In Portugal, the Connected Health platform is tackling that interoperability problem head-on. In Hong Kong, the Smart Care system is nailing workflow automation. And in the UK, an NHS rehab center is even giving patients control over their own environment. This isn't some future fantasy. This is happening today, right now.
So what's next? What's on the horizon? Where is all of this innovation headed? Let's take a peek at the clinic of tomorrow.
We seem to be moving toward a future of what you could call autonomous clinics, where AI handles more and more routine tasks, which frees up human doctors for the most complex cases. The focus is going to keep shifting from being reactive to being truly predictive and preventative. And ultimately, the clinic's walls are just going to dissolve, with our homes becoming the true center of our own healthcare journey.
In the end, it really all comes down to this. The smart clinic isn't just an option anymore. It's quickly becoming the new standard. It's a commitment to putting the patient at the absolute center of a system that is seamlessly connected, intelligently supported, and is always getting better.
So you see, the technology itself is no longer the barrier. It's here, it's ready. The real question that we're all facing now is this: how will we choose to use it to build a healthier future for everyone?
To explore how people and organizations are already answering that very question. For more, visit our website, Fair's Solution.